Welcome back. And we have another episode here with Dr. George. So I need to ask you a question.
Yeah.
Now, back in the day, if someone were to lose a tooth and had one stuck in there, they never really looked natural. If we're going to do one single tooth implant, can we do that? Can it look natural like the rest of our teeth?
Yeah, it can. Every situation is going to be a little bit different.
Okay.
Somebody like yourself, right? Smile. Yeah. So you see, when you smile,
Yeah.
you show everything.
Right? It looked like I swallowed an accordion.
Yeah. So you would be one of the most challenging types of situations because you can't hide your tooth underneath your gums.
Right.
Like some people, like myself, if I smile, you don't see my gums. Okay. In your case, you do.
Yeah.
And so if we don't get it perfect on me, we can probably get away with it.
Okay.
On somebody like you, we can't get away with that. It's going to show,
Yeah.
right? If the gum line is too high, the tooth is going to look too long. It's not going to look right.
Right.
You're going to smile and you're going to notice right away that tooth is twice as long as the one beside it.
Mm-hmm.
So if we have problems with the way that the gums drape around the implant, it's not going to look aesthetic.
Okay.
So what we call aesthetic zone implants, those are implants that we're doing in the front that show in your smile. When we do an aesthetic zone implant, it has a much higher, it's much more challenging.
Okay.
It's a higher risk for aesthetics, and what we try to do is we want to pull this thing off and we want to make it look as close to a natural tooth as we possibly can.
That's right.
And so that's where the challenge comes is in the aesthetic zone in the back. Nobody cares if the tooth is a millimeter longer than the one beside it. You can't see that. It's not really a big deal.
Right.
So, so just so everybody understands, when we do an implant, the traditional safest way of doing that implant is the tooth would be removed, and then we are going to allow the bone to completely heal.
Okay.
So we want that bone to be as if we never removed the tooth. Okay? And then we're going to place that implant into a healed site. So the bone is healed. We have, full set of bone, and we can go ahead and put that implant.
And how long is that process then for that bone to heal?
Yeah, generally 3 to 4 months.
Okay.
Okay, so generally the tooth would come out, we're going to let it heal 3 or 4 months, and then we're going to go back and place the implant. When we place the implant, traditionally what we like to do is we want to bury that implant underneath the gums and let it completely heal. So what happens is all implants are going to need 3 or 4 months for the bone to heal around that implant so that it's strong.
Okay.
The analogy I give people is it's like having a fence post in wet cement.
Absolutely. Well, that makes total sense, right?
The cement has to cure around that fence post before you start loading on it. Okay, so you can imagine that if you're building a fence, you don't want to put up the fence before you've even had the concrete set.
Yeah.
So that's the same thing with an implant. We don't want to put the teeth on it. We don't want to build that fence until the bone has set around our implant, which is going to take 3 or 4 months.
Okay.
So, and then we're going to build a tooth. That's the way that we've done it for decades. That is the safest way of doing implants, is to allow everything to be healed. The problem then becomes, how do we deal with the front? So say you're about to lose your front tooth. Mm-hmm. People don't want to go with no tooth for the next 6 months.
No.
They don't want to maybe wear a denture for the next 6 months. While they do this, people have to be in public. People have to talk. They don't want their denture falling out. Mm-hmm. So there's a lot of instances where they don't want to do this traditional thing. They want to bring it up. We call that doing tooth in a day.
Okay, tooth in a day.
So it's or an immediate implant.
All right.
So an immediate implant is where we are placing the implant into the tooth socket. So the tooth is removed and the implant is placed right away.
Okay.
So the bone hasn't healed, that socket hasn't healed. The problem that you run into with something like that is that the size of that tooth socket is generally bigger than the size of the implant.
Okay.
That implant screw is round and the socket might be oval, so we have gaps all around the implant, and so it's hard to secure that implant into a hole that is bigger than what the implant is.
Right.
So there's that challenge. And then there's the challenge of we want to put a tooth on top of it. Mm-hmm. So there's advantages, obviously, to being able to do it immediately, but there's disadvantages too, right? Like I said, this post is sitting in wet concrete. So you cannot load it.
Little shaky.
If we put that tooth on and you bite into something, you could, move that implant and then it's finished.
Okay.
It will not survive. So when we do a temporary tooth immediately, we have to do it in such a way that the person will not be able to bite on it. And then of course there's eating restrictions. You can't eat on this. You know, we can't put load on that until the implant has healed.
Okay.
Now, why would we do this in the first place? Why take the risk that you could bite into something and lose this implant before it's healed? And the reason is that, honestly, we discussed earlier in another video about how when you lose a tooth, we lose bone.
Right.
From the moment that tooth is removed, that bone is going to start remodeling right away. And sometimes what will happen is in the time period between, you know, when the tooth was removed and before the implant can be replaced, we're going to have shrinkage.
We don't want shrinkage.
So yeah, think about it here. So imagine, you know, in this particular case here, we're going to be replacing this tooth here. It fractured. I'll show you guys in a moment. Imagine, if you will, that I took this out and then this gum shrunk.
Ooh.
Right? Even if it shrunk a couple millimeters here, okay? What's going to happen is that when that gum shrinks down to here, now when we go to replace this tooth at a later on date, the tooth is now going to be this long.
And then people will definitely notice.
And you'll be able to see that this tooth is like this long now. It's not going to look good. On somebody like yourself, if that happened to you, you smile and you're going to see the one tooth being, you know, twice as long as the other tooth. It's not going to look good.
Nobody wants to be long in the tooth anyway, right?
Exactly. So, you know, so typically the advantage of doing it right away is that we can preserve that bone right from the get-go. We can preserve this architecture. This architecture is key.
Okay.
You see the way the gums drape around every one of these teeth. In the smile zone and the aesthetic zone, we want to try to maintain that as best as we can.
Right.
So let me show you a case here where I did an immediate implant on this lady who had fractured this tooth. So the first thing that you'll notice is that there's this little pimple here.
Okay.
You may or may not have noticed that. And so this pimple is actually an infection.
Okay.
And so she fractured the tooth down around this level, and there's bacteria in there that have caused an infection, and this is basically like a zit. It's draining, there's like pus coming out of that little thing there. So what we did was we put her on some antibiotics to get this under control, and then the next step is going to be now to remove this tooth and replace it with a dental implant.
Okay.
Okay? So the other thing I want you to notice here is the color of the gum tissue. You see this here? See how it's nice and pink?
Yeah.
And you see how we get to this area and it looks kind of purpley?
And a little reddy.
All right, so in a moment you're going to see why that is so.
Okay.
The infection here has destroyed some of the bone. And so we've lost bone in this area in here.
How long was the infection going on?
Probably only a few weeks.
Really?
Yeah. And she lost, you know, this amount of bone. So let's move forward here. So you can see here that the top is broken. I'm moving it here. The tissues are kind of blanching as I move this tooth. So that's the part that broke.
Okay.
And it fractured all the way down to here. Okay? So I'm going to remove this tooth now. I'm going to apologize because some of these pictures are going to show blood. So if you're squeamish, you might want to fast forward through this next part.
Right to the end, to the awesome.
To the end, to the awesome. But in the meantime, I'm going to walk people through how this would be done.
Okay.
Okay. So we're going to now remove this tooth, and I have already removed the tooth. It's out, and there's a socket in here. What I need to do is I need to gain access to this area in here so that I can modify that lost bone.
Okay.
I need to clean this all up. So I'm making a small incision here and here, and we're just going to release the gum a little bit. I'm not opening it right up. Sometimes I have to, but in this case I don't. And what I'm doing now is, so I've opened this up just to gain access here, and now I'm just cleaning up the tooth socket with a coarse diamond drill bit here just to roughen things up and remove any scar tissue that might remain on the bone. Now what I'm doing is this is my implant drill. And so what I'm going to be doing now is drilling the hole where my implant is going to go.
Okay.
Now the way that we're able to do this, like I said earlier, that socket is bigger than my implant is. So what I'm going to do is I'm going to slightly change the angulation of my drill so that I'm engaging new bone all the way down the inside of that socket.
Okay.
And of course, position is really key. You know, how high or how low I'm going to put that implant, and angulation. And you can see here that I have to thread a very tight space between this root and this root. We call this an osteotome. It's basically almost kind of looks like an ice pick, but it's the size and shape of the implant.
Oh, okay.
And I can actually expand the bone using that. We tap that into place lightly, and then it has depth markings here so I can see how deep I'm going with it. And so now I've prepared the hole, and now I'm going to pick up the implant, which comes in this little box here, and we're going to place that implant. So
There we
this
go.
is the implant itself. So this is the titanium
Getting
screw.
screwed down in.
Yeah, so I'm screwing that in, literally like putting one of those drywall anchors
Yeah.
into drywall. So we're putting that in. So now I've got it at the height where I want it. Now the key thing I want you all to notice here is take a look right here. You See
Okay.
how we can see this implant? See how you can see the threads of this implant? It's all exposed. And the reason is that infection that I was showing you earlier on the gum tissues has destroyed the bone all down the side here.
Wow. And that's only after a month or two.
Not even weeks.
Wow, weeks.
And so that when you see pus,
Yeah.
we call that liquid bone.
Oh, okay.
Because basically what's happening is that the bone is being destroyed. And so that pus that you get around a tooth if you have an infection, that's liquid bone.
Pus isn't good.
Pus is not good.
Not good.
So this bone was being destroyed here.
Okay.
So there's a couple things that I'm going to have to do here. Number one is I'm going to be building a tooth. And then number two is I have to repair this lost bone. I'm going to graft this defect to reconstruct that.
Tooth in a day, folks.
Yeah.
Tooth in a day.
So you can see where I want to maintain this gum tissue too. This is my temporary post, okay? And I showed you earlier on the model here, you know, how these implants come with the implant and then a post. And then this post is what's holding the crown on top.
Right.
So these posts can be made out of titanium, they can be made out of gold, they can be made out of different materials, or they can be made out of plastic or porcelain. And so in this case, because it's in the aesthetic zone, we're going to be using a white tooth-colored post. So here I am shaping it, and now I'm shaping it in the mouth to get the post to the correct size. You can see now I've got it shaped down approximately to the right size I need to hold my temporary crown.
Okay.
Now I'm going to make a temporary crown. I'm not going to bore you with all the details exactly on how I do it, but I'm building this crown out of a quick setting acrylic, and I'm going to shape it and build it, and now you can sort of see that I've got this crown now. And now how I contour this, I mean, those are the details, you know, for dentists to understand. And not all dentists have a good grip on being able to do something like that. And we're building a really nice tooth here. Now, this slide here is very interesting. Let me describe to you what you're seeing here. This jelly-looking pieces in here, basically what that is called platelet-rich fibrin. So we do a blood draw from the patient. So we take, maybe 30 milliliters of blood. We put that in a centrifuge. We spin it out. We remove the red blood cells, and we keep the platelets and the white blood cells. And platelets, as you know, one of their main jobs is to clot.
Right.
So when you get a cut, they clot up for you. And they release fibrin, and they stimulate the body to make fibrin, which is sort of like a collagen.
Okay.
And so what we're doing here is we're stimulating the platelets to make this fibrin for us. And so this is a fibrin mesh. And embedded in that mesh are all of your platelets.
Okay.
And what the other job that your platelets have is that they are they send out a lot of signal proteins into your body to stimulate your body to heal itself.
Okay.
So when you have a cut, the platelets are going there, they're trying to seal that cut closed so that you don't get bacteria invading through the walls of your castle. And then the other thing that they do is they send out a lot of signals saying, bring in all the workers, we got to rebuild this. We got to rebuild the wall, we got to keep, we got to fix this. So what we're doing is we're kind of turbocharging the healing here by bringing in a lot of platelets and then using this as a membrane to keep the gums out.
All right.
So I want to grow bone. These are my bone chips here that I'm going to place. And now I'm going to graft this hole. So right here, this is where we lost all that bone due to the infection. So you can sort of see the bone dips way down in this area here. So we're going to fill this in with my bone graft.
So it's kind of like your cement
Yeah.
in your little.
Yep, I'm mortaring
Okay,
around that
in your little
implant.
post,
As
right.
you saw in that earlier photograph how we had the implant was exposed,
Yeah.
partially exposed at the top. So I'm going to graft that now. And then I'm going to cover it with that fibrin membrane. And then I'm going to suture that all closed. So here I am packing that in right in here. We're packing into the defect and all around the implant wherever there was a space. and then we're going to suture that closed. So
Wow. So those are little stitches up there.
those are little stitches up here, and
Wow.
we've got that gum closed. Now, the shape of this tooth is a little bit shorter and a little bit more forward because I don't want her putting pressure on it when she bites. So these lower teeth were sort of biting into this area, and I've made it clear of her bite so she can't bite on it.
Okay.
So now we're just going to let her heal. So we let about 3 months go by, and this is how the area healed up.
Wow.
And you can see that, you know, the gums have healed beautifully. We had no shrinkage of the gum tissues at all. In fact, they're exactly where they were when we started. We've maintained this gum architecture here. So the gums are wrapping around here very nicely. This is still my temporary in place. You'll notice that the gum infection went away. The purple tissue's gone. We have this nice pink tissue sort of evenly across here. That's what we're looking for. And now I've just removed the temporary crown, and you can see how beautiful the tissues have healed around that implant. So here's our little implant post. Here's our tissues around that. We're going to capture that in an impression now, and we're going to have a tooth fabricated here for this patient. So now this is the final tooth, and that's what it looks like once it's in the mouth. And so, you know, this person now has a tooth. They never had to wear a denture. They didn't have any shrinkage. We're able to pull off, you know, small miracles and get these patients into a tooth that looks just like the rest of their teeth.
And nobody knew.
And nobody
The
knew.
whole time, right?
Yeah, the whole time. So, you know, she didn't have to wear a denture. She didn't have to go without a tooth. I'm just sort of doing final shaping on this tooth to make it look as good as possible. And that's how we finish up.
Wow.
And
I
so-
dare you to find the implant in there. Can you find it?
Yeah.
So good.
I can spot it right away.
Yeah.
You know, she wanted it a little bit whiter than the rest of her teeth. She had some other crowns that were also made a little bit whiter, and she was now going to do some whitening. She was going to do some bleaching of her teeth to whiten them up a little bit. I don't have a photo of how she ended up at the end, so we made this tooth just a little bit whiter so that she could go ahead and whiten up her teeth.
Right.
But that's the kind of thing that we can do today. You know, if we manage it from the beginning, we have a very good shot at perfection.
Okay.
That we can get it to look, you know, even in somebody like yourself who has a full smile, who shows everything, you know, you wouldn't be able to tell that one of your front teeth is an implant.
So that is the single implant.
That's a single implant in the aesthetic zone done as an immediate. So I just want people to know that it is possible that you don't have to have it done the traditional way. That isn't the only option. You know, some doctors will only do these the traditional way where they pull the tooth out and wait and then go back and put the implant and wait, and you're wearing a denture the entire time. There are other options, and I think people should know about that. So thank you for watching.